Back now on Triad today, and an appropriate time of the year, well actually any time of the year is appropriate to talk about heart health and caring for heart patients, and there's different ways you can do that. And we're going to speak with a young lady who's been with us before. We're so glad she's back. And we're going to talk about a special kind of cardiac care. With me right now, our good friend Kristie Szarpa, who's Senior Director of Practice Management for Mountain Valley Hospice and Palliative Care. Welcome back.
Thank you.
You sent me an email saying that we wanted to talk a little bit about something called advanced cardiac care. Now, what is that exactly?
Well, for our hospice patients who join our program, those folks have a special set of circumstances and symptoms. They can often be feeling okay and get real uncomfortable really quickly. So we want to be able to address those symptoms really quickly. So we've joined with American Heart Association and National Partnership for Hospice Innovation to create a program where we can have certain medications and responses set up in the home, so we can quickly address symptoms like chest pain, shortness of breath, and keep those folks out of the hospital, home, comfortable, and resolve that discomfort quickly.
Now, why is there such a focus from your standpoint on heart failure?
Well, it's just so pervasive. It's so common. You'd be hard-pressed to meet someone who doesn't know someone who has it or has it themselves. So heart disease is the #1 killer in our country. And on the journey of this illness, you have so many symptoms, and you have to change your lifestyle and sometimes your diet, and it affects your personhood. And so on the hospice portion of the journey, we're just really wanting to help people live as well as they can, with their symptoms managed, to feel well, to have some energy, to be able to enjoy life, and keep them out of the hospital is the key.
Yeah. Now who's qualified to actually get into your program, though? How do you decide that?
So anyone who's appropriate for hospice. So these are folks that have more end-stage heart failure, perhaps a prognosis of 6 months or less, although that's not firmly delineated. But we figure that out in conjunction with the patient's cardiologist, with their primary care doctor. We look at their medical record, at their illness journey, and figure out if they are hospice appropriate. And then of that population, we look at the folks who have this advanced cardiac disease and put together these special medication packets and just some extra special nursing support.
Yeah, now if I have an elderly parent who maybe is a candidate for hospice but also has heart problems, would she or he be able to keep their cardiologist they've been seeing?
Yes, absolutely. We work hand in hand with the cardiologist. Oftentimes our patients will become really comfortable with us, and it's tiring to run back and forth to the cardiologist and all these different appointments. But so we'll just see the patient, but we can be the eyes and ears for the cardiologist and reach out to them and collaborate as to whether or not a certain medication maybe should be tweaked or changed. So it is a partnership.
I think that's great that everybody's teaming up. Okay, now I promised I want to talk about this downloadable patient guide. I think we even have a graphic on this. What does this downloadable patient guide tell us?
So it's information for the patient and the caregiver, everything from soup to nuts about what is heart failure, what is it doing in your body, what are the symptoms, what are the medications used to treat, what are some health interventions you can do from a dietary standpoint or weighing yourself daily to help ward off uncomfortable symptoms. It's kind of a user's guide, if you will, and we have it in English and in Spanish.
And easy to download.
Easy to download and easy to understand.
Even for a non-tech guy like me, I can download it.
Absolutely.
Yeah, why are you laughing? You know. All right. Now, also I want to show the general website, mtnvalleyhospice.org. MTN stands for Mountain Valley, hospice.org. Check that out. There's also a number on screen. Kristie, thanks for all you do and for the folks and families you help.
Thank you so much.
We'll be right back after this.